Hi, my name is Ava Marie Harrison, and I am presenting my PowerPoint presentation on health promotion related to antibiotic use and resistance. And this is my audience. We'll just scan the crowd. Okay, basically what my presentation is based on is how a lot of our community people do not understand the appropriate use of antibiotic therapy and how overuse or misuse can cause resistance. So I'm going to move to my next slide and kind of go over, basically everybody needs to understand what our pros and cons are of antibiotic therapy. And I'm going to go over all of our different alternatives and our signs and symptoms of antibiotic resistance, and then I'm going to go over good bacteria versus bad bacteria, because a lot of people they hear bacteria and they think, oh, that's bad, I need antibiotics. But not all bacteria is bad bacteria. We actually have a lot of really healthy, normal, good, productive bacteria that grows in our body every day that helps us fight off infections without having to worry about taking any type of antibiotics. Antibiotic overuse can kill the sensitive bacteria. Sensitive bacteria is basically our normal healthy bacteria that grows in our body that helps us fight off everyday, bacterial infections or illnesses. Resistant bacteria is what is left to grow after our sensitive bacteria is dead. Our sensitive bacteria dies when people use antibiotics to treat infections that are not necessarily bacterial related, maybe they're viral related or something else that is not bacteria specific. When the sensitive bacteria is killed, resistant bacteria grows, which can cause multiple other resistant problems, illnesses, diseases that can occur, and I'll go kind of over those as PowerPoint goes on. Overuse and misuse also threatens the usefulness of important drugs. When you go in to the hospital or to the doctor, the clinic, because you have some type of bacterial infection, a lot of these very useful, important drugs that are normally used to treat bacterial infections, they don't work anymore, because now our normal flora that is affected when we use regular antibiotic therapy is no longer useful, because our body has pretty much resulted in a susceptibility in order to those antibiotics don't work for us anymore. They can't fight off those infections because now that our body has recognized this antibiotic and now it has developed an immunity towards it. The next thing is easily treatable infections are no longer easily treatable. We can't treat everyday common infections because the common infections, the antibiotics don't work anymore. Our body's already been introduced to those antibiotics, and now it's developed this kind of resistance towards it because it's already recognized it and developed, immunosuppressants. So next we go into overuse and misuse. Because our body's already used to everything, we have to overuse medications, and our body develops that resistance, which I already said. When it develops a resistance, you have to go to stronger antibiotic therapy, and that causes more severe illnesses. When you just start developing a more severe illness, antibiotic therapy gets a little bit tougher. Things that are considered broad spectrum, which means they treat a very mass variety of bacterial infections. Now we've developed something that can only be treated by certain antibiotics because our body no longer reacts to the antibiotics that it used to react to because it's already been introduced to those. Because we're developing more severe illnesses, we're now resulting in more doctor's visits, longer hospital stays, which is causing regular community people who could have just gone into the clinic, taken some over-the-counter medications or some antibiotics that might have cost $30 to $60. Now we're actually having to be admitted into hospitals. Our consumers are having to pay much more money because this illness has developed into something that is so much more severe than what it started out as, which could have easily been treated by everyday antibiotics if our body hadn't already been introduced to something that it has never seen before. Regular antibiotics can treat, certain common colds that are bacterial related, but because that common cold has already seen this bacteria, now we are no longer able to treat it. The susceptibility occurs when the doctor's visits and longer hospital stays eventually result in the more expensive and toxic medications. You've already been admitted into the hospital and now you're having to pay 2 to 3 times as much for your antibiotic therapy and your other medications, because these medications cost 10 times more because they're so bacterial specific. Our body now has very few drugs that can actually treat the infection, and those drugs are a lot more expensive. Later on it can result in resistant infections, and that can potentially lead to death. I mean, I've seen it before. There are several infections that if it's a bacterial infection and you've used every single antibiotic you can use to treat it, and all of those antibiotics are now resistant, what can you treat that infection with? You can't. And those patients will die. That's why it's so important to understand to use the right antibiotics when it's appropriate. Next, we'll go into antibiotic use. At least 30% of antibiotics prescribed to outpatient settings are not necessary. Antibiotics do not cure most acute respiratory infections because they're viral related. A lot of people come into the clinics and they think they've got upper respiratory tract infection, they've got bronchitis, they've got the common cold, they've got the flu, they've got a sore throat, and the patient themselves think that they need antibiotics. For some odd reason, they automatically result in, oh, it's bacterial related, I need antibiotics. And because they convince the nurse practitioner or the physician for the family practice that they want antibiotics, the consumer's always going to get what they want. A patient, no matter what, you're going to try to please your patient. And a lot of these patients do get prescribed antibiotics for things that, even though the physician may have done a throat swab or a certain test that they believe is viral, they still prescribe these patients antibiotics. Well, when you prescribe someone an antibiotic for something that's viral related, it is not going to cure that problem at all. And all it's going to do is that patient is eventually going to develop a susceptibility to that antibiotic. So the next time they get sick, even if it is a bacteria that's related to the antibiotic to treat it, it's not going to treat it. They're going to need something stronger, more expensive. And in that meantime, their body is developing something that is causing them to be resistant to that antibiotic. And it's destroying your normal bacteria, which causes you to fight off your regular infections. Some of these infections were, as I went over, the bronchitis, the common cold, several times the flu, sore throats. And then I kind of just go into antibiotics that are used to fight infections. But a lot of people don't understand is that antibiotics is literally from the foundation of the word antibiotics. They're drugs that fight bacteria. Antivirals fight viruses. So you have to kind of know what's going on with your body to know how to treat it. Bacteria is found inside and outside of our body. We've got good bacteria and bad bacteria, like I described in the beginning of my PowerPoint. Our good bacteria is, like I've said many times before, is our normal flora. And some of you might not know what normal flora is, but basically that's your good bacteria that grows inside your body. That's your everyday bacteria that helps you fight off all these random infections that go on that you don't even realize you've been infected with. Most bacteria that lives inside our intestines are very, very helpful. Antibiotics fight illnesses in one of two ways. They either kill any bacteria that is new that we're introduced to, or they make it very difficult for this bad bacteria that we're introduced to grow or to multiply. Well, you take antibiotics that your body's never seen before, and then it becomes, immune to those antibiotics. We're no longer able to kill that bacteria. We're no longer able to make it difficult for that bacteria to grow and multiply. So new gross bacteria grows and starts multiplying. Well, our normal flora is not there anymore to keep it from growing. So all this bad bacteria is constantly growing and multiplying. Next, I am going to talk about when it is appropriate not to take antibiotics. Okay, any infection that is viral related. I know a lot of times you go to a nurse practitioner, you go to your family doctor, you don't know whether something is viral related. Ask questions. That's very important. A lot of colds are not bacterial related. A lot of the different flu strands, they're viral related. You're not going to treat those with antibiotics. Most of your sore throats are viral related. Most coughs and most bronchitis, most sinus infections and a lot of ear infections, most of those are not bacterial related. So though you may think that you need antibiotics to treat them, they're not going to. They're not going to make them better. They're not going to make them go away. You're just going to hurt yourself. A lot of viral infections, need to be treated with antivirals, Z-Paks, etc. But they're not going to be treated with antibiotics. Antibiotic resistance occurs when bacteria change in the way that they reduce the effectiveness of drugs. Like I mentioned earlier, discussing how they only kill bacteria or they prevent it from multiplying and growing. Bacteria survive and multiply, which causes more harm. That's kind of how antibiotic resistance occurs. Then one of the most pressing health problems is antibiotic resistance. Next, illnesses become far more dangerous than just your everyday infection. When you could come into the hospital with a very common infection, and because your body has already been introduced to these antibiotic therapies, we don't have anything to treat it with. And it can become very, very severe, as I mentioned earlier. Bacteria can spread to family members, it can spread to schoolmates, and it can spread to coworkers. And so if you don't really care about whether you're resistant now, then think about all the people that are around you. And because you are now susceptible to spreading it to everyone else, not only are you affecting yourself and harming yourself, but you're affecting and harming all those around you. It majorly threatens the community. That's why it's so important that not only do I tell all of you this, but I want all of you to make sure that if it's ever brought up when you're around someone else, that they understand the importance of not just kind of throwing around the idea of, oh, just treat it with antibiotics. Because you hear that every day and you don't realize it, but it's very, very common. Prevention of antibiotic resistance. There's a lot of ways to prevent antibiotic resistance. Talk to your healthcare professional. A lot of your primary care physicians, they want you to talk to them. They want you to show initiative. If you have questions, ask while you have them in the room. If you don't understand how some type of illness or disease or infection works or how it even came about, ask about it. They're more than willing to answer your questions. Ask about symptomatic relief without the use of antibiotics. There are a lot of herbal remedies that you can use for sore throats. There are multiple things that you can use for the symptoms that are causing you problems without actually having to take any type of antibiotics, because your body's normal bacteria is going to be able to fight off those infections if you can just get through a lot of the symptoms. Take antibiotics exactly as prescribed. There are many, many, many people in our community that the prescription bottle says, take one pill twice a day, every 12 hours. How many of us actually take them every 12 hours? You think about when's 12. Okay, do I need to take it at 7 a.m., 7 p.m., 8 a.m., 8 p.m. It's very inconvenient sometimes, especially with having an everyday job or having kids or having lots of things going on. It's very hard to take antibiotics as prescribed. But if you decide to say, oh, I skipped a dose, that's not okay. Your body really does get messed up when you start missing doses or you start taking things out of the time sequence. It really does affect how that bacteria and that antibiotic works, because it can't kill the bacteria if it's not introduced to your body into a certain period of time. So it's very, very important for you to always take your antibiotics as prescribed. Always discard your leftover medications. If something comes up and your physician prescribed you 12 pills and they told you to only take 5, don't take all the extra ones. You always take them as your doctor prescribed it and throw them away. You cannot save. I know so many people that have had, say for example, amoxicillin. It treats a broad spectrum bacterial infections. Oh no, Mom, I have a sinus infection. Let's take some amoxicillin. No, that is not okay, ever. Because amoxicillin is prescribed for certain bacterial infections. Just because you have a sore throat doesn't mean that it's a bacteria-related sore throat. It could very easily be a viral-related sore throat. Now you're taking this amoxicillin thinking you're getting better, and all you're really doing is destroying your normal body's defense to fighting off whatever sore throat infection you might possibly have. Don't take anybody else's leftover medications, which goes to the next thing. Asking about vaccines used to prevent infections, and don't take antibiotics for viral infections, and never save antibiotics for the next time you get sick. Don't do that. If you get sick again, it's not the same bacterial infection. Your body has already treated the previous bacterial infection. It's already been introduced to these antibiotics. You don't need the same antibiotics to treat a new bacterial infection. It's not going to help your new bacterial infection, and all it's going to do is continue to destroy that normal flora. You're never going to be able to fight off your own infections if you continue to take the same antibiotics for a new infection. Just like I said about the vaccines, maybe this is viral. Maybe we should have taken a vaccine for this infection. You might think you have a sore throat and you really have the flu or meningitis or anything else. I mean, there's multiple things out there that have vaccines for. And like I said, you can't, until you go to a physician and you get a mouth swab and you know exactly what that bacteria is, you don't need to take anybody else's antibiotics. You really are just hurting yourself. Continued, never pressure a healthcare professional to prescribe antibiotics. I spoke about this earlier. Healthcare professionals, you come in, they want to treat you. They want you to feel better. They want you to feel happy about your care. If you're begging for antibiotics and you're not really taking anything but no for, or anything but yes, I guess, for an answer, they're going to give you the antibiotics, even though they know it's probably not going to help. But you as a person need to understand that not only is it not going to help, but it's majorly going to hurt you. Never skip doses. That kind of goes back to the whole me saying 12 and 12 hours. You cannot skip a dose. If you skip a dose, your body's not introduced to that antibiotic, and therefore it's not going to be treated with that antibiotic. Never stop antibiotics early. If you stop antibiotics early, it's not only is it not going to kill the bacterial infection, but later on, if that bacterial infection is reintroduced to your body, those antibiotics that you priorly used are not going to work anymore, because they recognize that antibiotic and they've already developed antibodies to fight off this treatment. When your body develops those antibodies and fights off this antibiotic that you were previously using, you have to now start a new antibiotic, and now your body's been introduced to 2 different antibiotics. Never take antibiotics that are prescribed for somebody else. That kind of goes back to Grandma has the amoxicillin or Mama has the amoxicillin and now I'm taking it because my throat hurts. Every infection is different. You don't know what your infection is related to. You should never, ever, ever take anybody else's antibiotics. They're probably not going to work for you regardless. And like I said before, they're continuously destroying your natural body's defense to fight off infections. Our bodies are made to destroy common infections. That's why we have that normal bacteria, that normal flora that's in our body. We're built to fight off as much as we possibly can. When we can't, then you step to antivirals, antifungals, antibiotics. Don't introduce your body to something that it doesn't need, because after you do, it's going to develop those antibodies and you cannot fight off regular infections anymore. Talk with your healthcare professional about the use of probiotics. Probiotics are basically the opposite of antibiotics. They are put into your system to help regrow and rebuild the strength of your natural body's normal flora. A lot of times people that have misused antibiotics start taking probiotics because they have developed all these terrible symptoms because of the antibiotic resistance, and they have to take the probiotics. Probiotics basically rebuild your immune system. They help refurbish those normal good bacteria that have been destroyed in the past and kind of rebuild your natural body's immune system and your natural body's ability to fight off infections. Prevention of antibiotic overuse, treatment before medications. As soon as you start feeling like you're getting sick or you might be coming down with something, start getting plenty of rest. Maybe you're not sleeping enough. You know, make sure that you're getting the adequate amount of rest for your age and your body. Drink lots of fluids. Dehydration can be one of the major problems that help throw you into some type of bacterial crisis or a viral crisis that causes you to go into your doctor and get a checkup. Use a clean humidifier or cool mist vaporizer. I'm a firm believer of clean humidifiers and cool mist vaporizers. I love those. They're great at cleaning your sinuses out and making sure the air is clean. However, if you have a humidifier and you don't check your filter every day, it's constantly filtering out this very dirty, dusty, bad air. It's not doing anything for you, and all it's doing is refurbishing dust and all types of bacteria into your air. So make sure that you're checking your air filters and your cool mist vaporizers. Those can be amazing, but they also can harbor lots of bacteria because there's so much moisture and water all in the tanks of the cool mist vaporizers. So make sure that you're paying a lot of attention to your air filters. Avoid smoking, avoid secondhand smoke and other pollutants, especially if you have any type of asthma history or respiratory problems. You know, you always want to stay away from anything that's going to cause harm to your lungs. Take Tylenol, ibuprofen, naproxen for pain and fevers. You know, anytime you start feeling like you're not feeling very well and you're running a little bit of a fever or you're hurting, you know, don't resort to any other medication that you've taken in the past. Go ahead and use your NSAIDs and your antipyretics to get your fever back down. And use saline nasal spray or eye drops. Say, for example, you're having red eyes or your eyes are feeling really, really dry. Maybe you're coming down with something that might be a little bit of sinusitis and you're feeling dry eyes. Don't go straight to your doctor and ask for an antibiotic drop. Try some saline drops, something like that first before you resort to something that might be prescription. Another way to prevent antibiotic overuse is good things for sore throats before you start resorting to medications is ice chips. They're really, really good for a sore throat. Throat spray, you can use chloroseptic spray. All it has is some lidocaine in it. It doesn't have any type of antibacterial in it. It just kind of numbs your throat, helps kind of ease the soreness. Gargle in salt water. Salt is a wonderful natural herbal remedy. And drinking warm beverages. Anytime you have a very sore throat, a lot of times you think it's related to it's just dry or it hurts and you want to resort to something very, very cold, but actually cold beverages shock the vocal cords and can cause a lot of vasoconstriction, so they cause more harm on your throat than they do good. Ear pain, you can use warm, moist towels to the affected ear. Say that your young child has got an earache really bad and you're not really sure exactly what's going on yet. You can always just kind of use a very, very warm, moist towel, let them lay down with it over top of their ear. A lot of times that will soothe the pain. For runny noses, you can use decongestants. You can use nasal saline spray, things to break up those mucuses, and it does cause runny nose, but it gets a lot of that mucus out. For a cough, you can breathe in steam. A lot of times I know a lot of people that have had a really bad cough and they have literally turned on the hot shower, turned on the hot water in the bathroom, closed the door, and they'll just breathe in steam, and that helps a lot to kind of break up things. Medicated lozenges for adults. You can use the non-medicated lozenges for children, but if they're under a certain age, you don't need to use any type of medicinal lozenges for children. And then honey is really good for children under the age of 1 year, but also honey is a very natural herbal remedy for people of any age. It's got natural antibacterial fighters in it that help soothe your throat. They also fight off bacteria. Honey can really help a lot with sore throats and several different problems in the respiratory tract. Lastly, we just kind of go over any questions and comments. So if anybody has any questions or any comments about anything that I've discussed, they can voice their opinion. Anybody have any questions? How many minutes has it been?